baby's mouth is important for the child's digestion and nutrition. Keeping good baby oral health with sound teeth is essential not only for a healthy and beautiful smile, but also for maintaining overall health. Your child's teeth are not only important for chewing, speech, and appearance, but they are also important for the development of healthy adult teeth. Your baby's teeth start developing during the first 3 months of your pregnancy. Therefore, taking care of your baby's teeth starts very early in your pregnancy by preventing problems throughout pregnancy. A healthy pregnancy is important for healthy baby teeth, so keep your doctor visits to ensure good oral health. Calcium is important for healthy baby teeth. Make sure to get enough calcium as advised by your doctor. Make sure to have healthy snacks and regular balanced meals to get the variety of food needed for the proper nutrition for both a healthy mother and baby. Throughout pregnancy and nursing, the mother should avoid certain drugs and medicines without prescription. The mother should avoid harmful things like cigarette smoking, as it can cause low baby birth weight and can increase the risk for baby tooth decay. Also, avoid alcoholic drinks, since this can have lifelong effects on your child. Different teeth develop and erupt at different ages. Typically, the baby's first teeth erupt at 6 months of age. However, some babies may have them much later. By 12 months, your baby can have 8 to 12 teeth, including some back teeth. By the age of 18 months, your child can have all front teeth and most of his back teeth. Your child will have a complete set of teeth, a total of 20, by age of 2 to 3 years. Teething is often accompanied by pain in the gums, mild fever, rash around the mouth, and sometimes ear infections. A cool teething ring can be given to the child to ease the discomfort. Over-the-counter teething medications may provide temporary relief, but these medications must be used sparingly and only under dental or medical supervision. There can be quite a bit of variation as to when the teeth come into the mouth. The sequence is more important than the ages of eruption. Baby teeth often have gaps between them. This is a common concern for many parents. Be assured that this is quite normal and in fact beneficial for the healthy development of the child's permanent teeth. It is important to appreciate that your child's permanent teeth are growing underneath his baby teeth right from birth. Normal growth and proper care of baby teeth will help to ensure healthy adult teeth. For good health and healthy teeth, your child's diet should include the basic food groups: dairy products such as milk, yogurt, and cheese, whole grains such as breads, cereals, and pasta, fruits and vegetables, meat, poultry, and fish. A well-balanced diet is important for the healthy development and maintenance of teeth and gums. Sugary snacks and starchy foods are the main types of food that can cause cavities, especially the sticky kinds of foods. Daily oral hygiene home care should start early in life before teeth come in. You should wipe the gums frequently with clean damp cloth or gauze immediately after meals or feedings. Brushing should start when the first teeth come into the mouth. Any soft bristle toothbrush with a small head, preferably one designed specifically for infants, should be used. You may use a baby teeth cleansing gel that contains no fluoride in it. The objective of brushing is to clean the plaque off teeth. Plaque is a thin layer of bacteria that forms on teeth. This layer of plaque is not easily visible, but can be seen after using certain plaque coloring dyes. Teeth should ideally be brushed immediately following each meal or snack. Thorough brushing of teeth is essential for the prevention of cavities and for healthy gums. Teeth should be brushed long enough to clean plaque from all tooth surfaces. You must supervise and help your child during brushing at all times to ensure proper teeth brushing. Once all the baby teeth are in, flossing should be done at least once a day, especially before bedtime. It helps prevent cavities between teeth and should be done where there are tight contacts between the teeth. Drinking fluoridated water may help to build resistance to dental decay, but when it is combined with other fluoride sources, toothpaste for example, it increases the risk for defects on the growing permanent teeth. If you live in an area where the water does not contain fluoride, check with your dentist. He might suggest an alternative for children 3 years of age or older when it is necessary. When the child is about 2 years old, or when the back baby teeth are in, baby toothpaste with fluoride should be used during brushing in no more than a small pea-size amount. Children must not be allowed to swallow toothpaste, as this might lead them to getting sick. Also, swallowing large amounts of toothpaste by very young children can result in damaged permanent teeth that are white spotted or darkly stained. If your child is known to be at risk for getting cavities, the dentist may provide fluoride treatment during regular dental visits. Tooth decay and gum disease are caused by certain types of germs called bacteria. Those bacteria usually come from the mouth of the person who is taking care of the baby, usually the mother. Bacteria can be transferred during play, by kissing, and by sharing spoons or foods with the child. You as a parent or caregiver should have good oral hygiene practices, as this will reduce the chance for your children getting those bacteria in their mouth. Another risk factor that leads to the development of cavities in baby teeth is the habit of putting babies to sleep with a bottle containing milk or juice. The oral bacteria use the sugar to create acid to cause cavities. The baby's last feeding should be followed by cleaning of the teeth before the baby goes to sleep. Plain water can be given instead if nighttime bottle cannot be avoided completely. Usually, weaning from the bottle to a training cup should be planned by 12 months of age. However, the use of a sipping cup should only be allowed when your child needs to drink. Providing milk or juice in a sipping cup for long periods of time can also cause cavities. If you are breastfeeding your baby, you should also clean your baby's teeth after each feeding, because breast milk can also cause cavities. Children's medicines often contain sugar syrup. Teeth should also be brushed after taking each dose of sweetened medications. Early baby tooth decay is the most common chronic infectious bacterial disease affecting children in North America. It can cause severe pain, infection, inability to eat or sleep, and lots of discomfort and worry for you as a parent or caregiver. Baby tooth decay also requires extensive treatment, especially in the case of severe cavities. This treatment can involve the use of hospital facilities, medical and nursing staff, and medical equipment. Such treatment can be very expensive. It is important to remember that baby bottle tooth decay is completely preventable. A sucking habit is not only important for getting nutrition, but also needed for comfort and for the exploration of the surrounding environment. The sucking habit is normal for young children, but should be stopped preferably by 3 years of age. Some children retain the sucking habit for a long time beyond that normal age. Beyond 4 years of age, these sucking habits can affect your baby's teeth and jaws, leading to crooked teeth and open bites. Beyond a certain age, these problems will not correct by themselves, and only dental treatment can correct the bite back to normal. Accidents to baby teeth are unfortunately common. They can be avoided by taking some simple precautions. These include the use of the proper car safety seats for your child according to his weight, accident-proofing your home, especially when the child is learning to walk, and avoiding baby walkers and bath seats, which can be hazardous. If your child has a playpen, check with the manufacturer to make sure that it is not defective or recalled for safety reasons. The use of helmets for head protection during sports activities such as riding bikes or scooters, roller skating, and skateboarding is mandatory for your child's safety. Your child's helmet should fit properly and not be tilted backwards or forwards. The Y-shaped strap should fit snugly just below the ears. Injuries to baby teeth can adversely affect the child's permanent teeth. Therefore, in case of accidents to your baby's mouth or teeth, see your child's dentist immediately. Unlike adult teeth, knocked out baby teeth should not be put back in place. In cases of severe injuries to the baby teeth, your dentist might have to take out the injured teeth. Therefore, avoid injuries by using safety precautions. The dentist should see your baby within 6 months after the first tooth erupts, but no later than 12 months of age. This first dental visit is as important as the well baby visits with the baby's doctor. It will help your child get used to dental visits and regular oral care. As with your family doctor, your child's dentist is trained to deal with the difficulty of examining very young children. An easy way for the dentist to examine your child's mouth is the knee-to-knee examination position.
Okay, Mrs. Graham, we're ready to take a look at Isabel's mouth. Now, the way you're sitting on the chair is perfect.
First, you will hold your child face to face, then sit with your knees facing the dentist.
With her legs on either side of your lap.
Second, you will place your child's legs on each side of your waist. Then the dentist will ask you to lay down your child's head on the pillow while holding his hands. The purpose of this first dental visit is for your dentist to record information about your child's birth history and his present state of health, examine his mouth, and provide guidance to help you in keeping a healthy mouth for your child right from the start. Some children are likely to have a higher chance of getting oral problems. Your dentist can identify these potential problems and provide strategies for preventing them. Keep regular dental visits to get professional care and advice based on your child's specific needs. Seeing your dentist is important to ensure good baby oral health and to detect and treat any oral problems as early as possible. Taking your child regularly to the dentist is important to ensure lifelong good oral health. Remember, following and ensuring these early steps, healthy pregnancy, healthy nutritious diet, good oral hygiene, appropriate use of fluoride, and regular dental visits will provide your child with a lifelong healthy and beautiful smile.